Hi, my name's Amanda and I'm a pharmacist. Today I'll be talking about narrow therapeutic index drugs. And if you find this video useful, please press the like button and subscribe to my channel and share it with others who may find it helpful too. Thanks, I really appreciate it. So first we'll begin with just a definition of therapeutic index. Therapeutic index, abbreviated TI, is the ratio between the toxic dose and the effective dose of a drug, so it's the margin of safety. More specifically, it is the ratio of toxic dose in 50% of the test group to the effective dose in 50% of a test group. So you can see the formulas there set up as a ratio or like a fraction. So for example, a drug with a therapeutic index of 10 would be considered safer than a drug with a therapeutic index of 3. So basically, a high therapeutic index drug is going to have a very large toxic dose and a very small effective dose. So this creates a very wide margin of safety. But on the other hand, a low therapeutic index drug, the toxic dose and the effective dose are pretty close together. So this means there is going to be a narrow safety margin. And these drugs will require close monitoring to avoid toxicity because the toxic and effective doses are so close. So specifically, what are narrow therapeutic index drugs? These are drugs in which a small difference in dose or blood concentration may lead to serious therapeutic failures and/or adverse drug reactions that are life-threatening or result in significant disability or incapacity. So basically, there's a small change in a drug dose or blood concentration is going to cause a very significant undesired effect. And just a little bit more information about narrow therapeutic index drugs. These drugs require close monitoring when started and when dosage changes are made to avoid adverse effects. And narrow therapeutic index drugs are more likely to cause adverse effects in certain patient groups. Those who are older, those who have multiple illnesses, which is called comorbidity, those on multiple medications, this is known as polypharmacy, and those patients with reduced liver or kidney function. The reason for this is those are the ways the body eliminates drugs. So if there's reduced elimination of drug, you're going to have elevated levels in the body. And many narrow therapeutic index drugs require therapeutic drug monitoring, or TDM, and this is basically just the measurement of drug levels in the blood. So now we'll talk about some of the common narrow therapeutic index drugs. There's no standard list of NTI drugs. Certain classes of drugs are more likely to be considered narrow therapeutic index, and there are 4 classes that you can basically think about with this. There's anticoagulants, antiarrhythmics, immunosuppressants, and anti-seizure drugs. Of course, there are other drugs in other classes that are narrow therapeutic index, but these are 4 main categories that you see many narrow therapeutic index drugs in. So some common narrow therapeutic index drugs we'll look at in a little more detail today are Warfarin, Digoxin, Cyclosporine, tacrolimus, carbamazepine, phenytoin, phenobarbital, theophylline, levothyroxine, and lithium. So we'll start first with Warfarin, brand name Coumadin. Warfarin is a vitamin K antagonist blood thinner for the prevention and treatment of blood clots. Monitoring required for Warfarin would be the PT-INR blood test, which measures how long it takes for clotting to occur. And the goal INR is generally 2 to 3. And side effects that can indicate toxicity include heavy bleeding that doesn't stop, easy bruising, bleeding gums, frequent nosebleeds, red spots on the skin, pink, red, or dark brown urine, black or bloody bowel movements, vomiting blood, severe stomach pain, and severe headache and dizziness. So it's a lot of things that would indicate that blood is not clotting the way it should. And treatment for toxicity, of course, you would skip warfarin doses and also administer vitamin K, oral or injectable, to increase clotting. Next, we'll look at Digoxin, brand name Lenoxin. Digoxin is a cardiac glycoside for heart failure and abnormal heart rhythms. It works by inhibiting the sodium-potassium ATPase enzyme. Monitoring for digoxin includes digoxin and potassium blood levels, kidney function, and watching for signs of toxicity. Side effects that can indicate digoxin toxicity, they're usually pretty vague, so this one can be difficult to miss. lack of appetite, nausea, vomiting, fatigue, diarrhea, confusion, hallucinations, restlessness, weakness, depression, visual disturbances, blurred vision, or halos around bright objects. That's a hallmark sign of digoxin toxicity. Heart rhythm changes. And toxicity treatment includes stopping digoxin and administering a digoxin antibody called Digibind, monitoring levels, and then just supportive care. Next is cyclosporine. Brand name is Neural or Sandimmune. Cyclosporine is an immunosuppressant used to prevent organ rejection in people who have received a transplant. Monitoring includes cyclosporine drug levels, the TDM that we talked about earlier, renal and liver function, magnesium and potassium, so also some electrolytes there. Toxicity with cyclosporine can cause irreversible kidney damage and neurotoxicity. This includes seizures, altered mental function, headaches, hypertension, visual disturbances, and blindness. Next is tacrolimus. Brand name is Protopic or Prograf. It's very similar to the cyclosporine. Tacrolimus is a calcineurin immunosuppressant for prevention of kidney transplant rejection. Monitoring includes the TDM tacrolimus levels, kidney and liver function, and also the electrolytes. And toxicity, you see with it, is very similar with nephrotoxicity, the kidney damage, and neurotoxicity. Next is carbamazepine. Brand name is Tegretol. Carbamazepine is an anti-epileptic drug used for seizures, bipolar disorder, and nerve pain. Monitoring includes carbamazepine levels, the therapeutic drug monitoring, electrolytes, liver and kidney function, and also CBC, or complete blood count. Toxicity with carbamazepine can include ataxia, which is impaired coordination, dizziness, diplopia, which is double vision, sedation, and persistent headache. Next is phenytoin. Brand name is Dilantin. It's also an anti-epileptic drug for prevention and control of seizures. Monitoring for phenytoin includes phenytoin therapeutic drug monitoring levels, electrolytes, and liver and kidney function. And some signs of toxicity include ataxia and diplopia, just as with the carbamazepine. Also dizziness, drowsiness, slurred speech, nausea, and decreased appetite. Next is phenobarbital or sulfaton. Phenobarbital is a barbiturate anti-epileptic drug used for seizures, and it's a DEA Schedule 4. Monitoring for phenobarbital includes the phenobarbital levels and liver and kidney function. Toxicity signs include slow and shallow breathing, weak pulse, feeling cold, pinpoint pupils, fainting, confusion, and sedation. Next is theophylline. Brand name is Theodure. This is a methylxanthine bronchodilator for lung diseases such as asthma and COPD. Monitoring for toxicity includes theophylline blood levels with the therapeutic drug monitoring, and also liver function. Toxicity signs include seizures, disturbances in heart rhythm, severe vomiting, and electrolyte disturbances, namely low potassium, which is known as hypokalemia. Next is levothyroxine. Brand name is Synthroid or Levoxyl. Levothyroxine is a synthetic T4 thyroid hormone for hypothyroidism. Monitoring includes the TSH and free T4 blood levels. And toxicity signs can include anxiety, hair loss, weight loss, tremors, heart palpitations, flushing of skin, and heat intolerance. Next is lithium. Brand name is Lithobid or Escalith. Lithium is a mood stabilizer for manic episodes of bipolar disorder. Monitoring for toxicity includes lithium blood levels and sodium levels, and also monitoring the thyroid with the TSH. Toxicity signs can include muscle weakness, twitching, drowsiness, blurred vision, ringing in the ears, confusion, slurred speech, irregular heartbeat, trouble breathing, and seizures. And that's just a brief overview on some of the common narrow therapeutic index drugs. And now we'll just look at a little summary and some key points to remember. Narrow therapeutic index drugs can have significant undesired effects with a small change in dose because their toxic and effective doses are close in range. Many narrow therapeutic index drugs require therapeutic drug monitoring, or TDM, which is the measurement of drug level in the blood. And in addition to TDM, it is important to know signs and symptoms that can indicate toxicity. And there are drug classes that are more likely to have narrow therapeutic index drugs. These include anticoagulants, antiarrhythmics, immunosuppressants, and antiepileptics. But know that there are also drugs that are narrow therapeutic index in other classes as well. Thanks for watching. Please like and share this video with others who may find it helpful, and please subscribe to see more of my drug information videos. Thank you.